Mark Rudolph.
My name's Andrew Fortunato.
And I'm Susan Gregory.
And we're here from Families Against Narcotics. Families Against Narcotics is a grassroots organization that came together following the deaths of some of our kids. One of those was my son, Ryan. We go around and we try to do a peer-to-peer type discussion. If we're talking to young people in schools, we try to bring young recovering addicts with us to talk to the students about the dangers and how the drug abuse was not going to affect their lives. They were just having fun, and that one day they wake up and realize that they've crossed the line. They're addicts.
Yeah, I remember there was an incident with my son when he was using, where we had a family event. And at the end of the day, as we were leaving and driving home, I received a panicked phone call from a family member who noticed that some prescription pills were missing from their house. She knew in her heart right away that my son had taken the pills, and I knew as well. And it was devastating. It was devastating because, number one, the pills were missing, and the family member who needed the medication was without it, and they were going to be suffering because when you have a prescription narcotic, you just can't go and get that refilled. We did confront my son. He eventually came home, and he denied taking the pills, but we could tell by the look in his face. You know, the guilt and the shame was all over his face. He didn't, he knew that he had hurt his family, that he had loved, but yet at the same time, he wasn't willing to take responsibility yet for what he had done.
I started using prescription drugs when I was roughly 16, going on 17 years old. When I started using prescription drugs, it was a downhill slope and it was steep. Where I got them from was almost invariably, at least at the beginning, from prescription drugs that their parents or my parents or somebody close had in the house. It was so difficult to continue getting as many as I needed that I would do anything I needed to do to get those drugs, whether that was stealing from a sick grandmother or stealing from a mother who was fresh off of a surgery that needed the pills. It really didn't matter. And never in my life did I think, being a straight-A student, coming from a family, close-knit family with morals, values, that did things like go to church, that did all the normal things, that I'd ever get to that point. Yet I did. Today, I'm in a good place. Just under a year of continuous sobriety. I'm a full-time student working on a psychology and social work degree, so hopefully I can go further in helping people in a more formal setting.
I mean, these have legitimate medical purposes, these drugs, but that we're careful with them and that we put them away, that we lock them up. Hiding them isn't good enough because our kids learn where the hiding places are. So we need to they have devices now where you can literally lock them away, and they're not available to our kids.